My name's Carmen Di Pasquale. I'm a cardiologist here at Flinders Private Hospital. I'm going to answer some questions that patients frequently ask about their stay in Flinders Private Hospital with a cardiology issue. I hope it's useful to you. Finding the right cardiologist is a difficult thing for patients, and my usual advice would be that you should trust your referring doctor, which is generally your general practitioner. They will have experience with different cardiologists, they will have a relationship with cardiologists and trust in them, and they've got your best interests at heart. So I think my fallback position would be follow the lead of your referring doctor. When you visit a cardiologist, the procedure will be much like you've experienced with any other doctor you see for the first time. They will talk to you, we call that taking a history. They'll examine you, especially the heart and the lungs, and then generally there'll be tests performed to look at how your heart's functioning and to try and get to the root of the problem that there is. The initial test that a cardiologist will perform is generally what's called an ECG, which is a simple thing of sticky dots on the chest with wires to look at the electrical activity running through the heart. An ultrasound of the heart, which we call an echocardiogram, which is a very safe, non-invasive test. A stress test is often performed to look for blocked arteries, where we get patients to walk and even run on a treadmill while their heart is monitored. And then there are imaging tests, which can take the form of a CT scan, an MRI scan, or even a coronary angiogram, where we put a catheter into the heart from the wrist and take X-ray pictures of the heart arteries that give blood to the heart to see if there are any blockages. You do not need private health insurance to see a cardiologist. You do, however, need private health insurance to be looked after for an inpatient stay in a private hospital. How long does it take to recover from surgery? I'll split this question up because a lot of patients consider stenting and pacemaker insertion as a form of surgery. So when a patient has a stent put in their heart, they're generally in hospital just for the one night. When patients have a pacemaker inserted, that's a little bit of a bigger procedure, but again, just one night in hospital. They might leave with some tenderness and soreness over their shoulder, even a bruise, but there's not much more than that. In terms of recovery after cardiac surgery and the experience of cardiac surgery, this is obviously a much bigger operation performed by a cardiac surgeon, and that involves quite a recovery. So patients are generally straight from the operating theatre transferred to the intensive care unit, generally one night in the intensive care unit, and then they come out to the ward where they're managed by the cardiac surgeon and the cardiologist here in the hospital, as well as the physio, the nurses, dietitian, and all the other ancillary medical professionals that are needed after someone has cardiac surgery. Patients begin to mobilise on days 2, 3, and usually people are discharged home or to somewhere where they can have an eye kept on them by a loved one or a rehab hospital after about 5 to 7 days. Generally, we say to patients that you're not back to your best and full activity and back to work for 6 weeks after cardiac surgery. In terms of what questions you should ask your cardiologist, my answer to that is simple. Anything on your mind, you should feel very comfortable, and you should have a relationship with your cardiologist and indeed your cardiac nurses on the ward in the hospital to ask them whatever's on your mind. There's no question that's too silly or too minor. If it's bothering you as a patient, you should ask your cardiologist, and you should have the relationship with your cardiologist and your cardiac nurses that you feel comfortable doing so. Thank you for listening. I hope that you've found this information useful and it's answered some of your questions. Remember, if you have sudden onset or severe cardiac symptoms, to call an ambulance and get attention quickly, and indeed Flinders Private Hospital does have a cardiac emergency centre which is open 24 hours, 7 days a week for just such issues. But prevention's better than cure, so look after yourselves.